In the narrow streets of Toulouse's medieval quarter, where the scent of fresh bread mingled with the dust of ancient stones, a baker's wife named Colombe Chatry would carry one of medicine's most extraordinary secrets for nearly half a century. What began as a tragic miscarriage in 1849 would become a medical marvel that challenged everything physicians understood about pregnancy, death, and the body's capacity for preservation. For 46 years, Colombe unknowingly harbored within her abdomen a perfectly preserved fetus, calcified into stone by her own immune system in a desperate attempt to protect her from the foreign tissue that her body could neither expel nor absorb. When X-ray technology finally revealed her secret in 1895, it would force the medical community to confront the possibility that death and life could coexist within the same body, that a woman could become a living tomb for her own child, carrying the calcified remains of her unborn baby as both burden and blessing through decades of ordinary existence. The Toulouse of 1849 was a city steeped in history and tradition, its pink brick buildings and narrow cobblestone streets bearing witness to centuries of human struggle and triumph. As the capital of the Haute-Garonne department in southwestern France, Toulouse served as a vital commercial center where the agricultural wealth of the surrounding countryside was transformed into the goods that sustained urban life. The city's economy was built on a foundation of small family businesses, bakeries, textile workshops, leather goods manufacturers, and wine merchants that had operated from the same locations for generations. These enterprises were typically passed down from father to son, creating a stable social structure that provided security and continuity in an era of political upheaval and economic uncertainty. The Garonne River, flowing through the heart of the city, provided both transportation for goods and power for the mills that processed grain into flour. The riverbanks were lined with warehouses and workshops where the raw materials of rural France were transformed into the finished products that supplied not only Toulouse, but much of southwestern France. Colombe Dubois had been born in 1824 into this world of artisan tradition, the daughter of a master baker whose family had operated a bakery in the Saint-Cyprien quarter for over a century. The Dubois bakery was known throughout Toulouse for the quality of its bread and pastries, and Colombe had grown up surrounded by the rhythms of the baking trade, the early morning preparation of dough, the careful tending of ovens, and the daily interaction with customers who depended on the bakery for their daily bread. As the eldest daughter in a family of 6 children, Colombe had been expected to learn the domestic skills that would make her a suitable wife for another artisan family. She had mastered the arts of cooking, sewing, and household management, while also developing an understanding of the business aspects of running a bakery that would serve her well in her future life. In 1847, at the age of 23, Colombe had married Henri Chatry, the son of another baking family whose shop was located in the Capitole district near the center of Toulouse. The marriage was both a love match and a business alliance, combining 2 established baking enterprises and creating opportunities for expansion that neither family could have achieved alone. Henri was a skilled baker who had inherited his father's talent for creating the complex breads and pastries that were the specialty of Toulouse's baking tradition. He was also a gentle and caring husband who treated Colombe with the respect and affection that were sometimes rare in marriages of that era. Together, they had established a comfortable life in the apartment above their bakery, where they planned to raise the large family that was expected of couples in their social position. The pregnancy that would change Colombe's life forever began in the autumn of 1848, during a period of political turmoil that had seen the overthrow of King Louis-Philippe and the establishment of the Second French Republic. Despite the uncertainty of the times, Colombe and Henri were overjoyed at the prospect of their first child, and they made careful preparations for the arrival of the baby they expected in the spring of 1849. Colombe's pregnancy had proceeded normally through the first 6 months, with the usual symptoms of morning sickness, fatigue, and the gradual swelling of her abdomen that marked the growth of the child within. She had continued to work in the bakery, though Henri had insisted that she avoid the heaviest tasks and the extreme heat of the ovens that could be dangerous for both mother and child. The local midwife, Madame Rousseau, had examined Colombe regularly and pronounced the pregnancy to be progressing well. Madame Rousseau was an experienced practitioner who had delivered hundreds of babies in Toulouse's working-class neighborhoods, and her reassurances had given Colombe confidence that her first childbirth would be successful. However, in February 1849, when Colombe was in her 7th month of pregnancy, she began to experience severe abdominal pain that was unlike the normal discomforts of pregnancy. The pain was sharp and localized to one side of her abdomen, and it was accompanied by nausea and dizziness that forced her to stop working and take to her bed. Madame Rousseau was summoned immediately, and her examination revealed that Colombe was experiencing what appeared to be the onset of premature labor. The midwife had seen such cases before, and while they were always concerning, she believed that with proper care, both mother and child might survive, even if the baby was born several weeks early. Over the next several days, Colombe experienced intense cramping and heavy bleeding that seemed to indicate that her body was attempting to expel the fetus. The pain was excruciating, and she was forced to remain in bed while Henri and Madame Rousseau took turns caring for her and monitoring her condition. The bleeding continued for nearly a week, during which time Colombe lost a significant amount of blood and became weak and pale. Madame Rousseau administered herbal remedies and encouraged Colombe to rest, but there was little that could be done with the medical knowledge and techniques available in 1849. Then, as suddenly as it had begun, the bleeding stopped, the cramping subsided, and Colombe's pain gradually diminished to a dull ache that was manageable with rest and simple remedies. Madame Rousseau examined her patient and concluded that Colombe had suffered a miscarriage, though the absence of fetal remains was puzzling. The midwife explained that sometimes, particularly in cases of early pregnancy loss, the fetal tissue could be completely absorbed by the mother's body, leaving no physical evidence of the pregnancy. This explanation seemed reasonable to both Colombe and Henri, who were devastated by the loss of their expected child, but grateful that Colombe had survived what could have been a life-threatening complication. Over the following months, Colombe's abdomen gradually returned to its normal size, and she appeared to recover completely from her ordeal. However, she never menstruated again, a condition that Madame Rousseau attributed to the trauma of the miscarriage and the significant blood loss she had experienced. What neither Colombe nor her caregivers realized was that she had not experienced a typical miscarriage, but rather an ectopic pregnancy, a condition in which the fertilized egg implants outside the uterus, usually in one of the fallopian tubes. In Colombe's case, the fetus had developed in her abdominal cavity, where it had grown for 7 months before dying from lack of proper blood supply. When Colombe's body had attempted to expel the dead fetus, the process had been incomplete. The fetus, now deceased but still present in her abdominal cavity, had become what medical science would later term a foreign body, tissue that the immune system recognized as not belonging to the host organism. Unable to expel or absorb the fetal remains, Colombe's immune system had responded by encasing the dead tissue in layers of calcium deposits, gradually creating a hard shell around the fetus that would preserve it indefinitely. This process, known as calcification, was the body's way of isolating potentially harmful foreign material and preventing it from causing infection or other complications. The calcified fetus, or lithopedion, remained in Colombe's abdominal cavity as she resumed her normal life. She and Henri mourned their lost child and eventually began trying to conceive again, though Colombe never became pregnant. They attributed this to the trauma of the miscarriage and accepted their childless state as God's will. In 1852, Henri died suddenly of pneumonia, leaving Colombe a widow at the age of 28. The loss of her husband was devastating, but Colombe was determined to maintain the bakery that had been their shared enterprise. With the help of Henri's younger brother, she continued to operate the business and gradually built a reputation as one of Toulouse's most skilled bakers. 3 years later, in 1855, Colombe married Auguste Moreau, a widower with 3 children who owned a larger bakery in the Esquirol district. The marriage was primarily practical. Auguste needed a wife to help care for his children and manage his household, while Colombe needed the security and companionship that remarriage could provide. Auguste was a kind man who treated Colombe's stepchildren as if they were her own, and she found fulfillment in raising them and helping to expand the family business. The Moreau Bakery became one of the most successful in Toulouse, known for its innovative pastries and its reliable supply of high-quality bread. Throughout these years, Colombe occasionally experienced a strange hardness in her lower abdomen, particularly when she bent over or lifted heavy objects. She mentioned this to Auguste, who suggested that she consult a physician, but the doctors she saw dismissed her concerns as normal signs of aging or perhaps benign tumors that were common in women who had never given birth. The medical understanding of abdominal conditions in women was limited in the mid-19th century, and physicians often attributed unexplained symptoms to hysteria or other vague conditions that were thought to be related to the female reproductive system. Colombe's symptoms were not severe enough to interfere with her daily life, so she learned to live with the occasional discomfort. As the years passed, Colombe became a respected figure in Toulouse's baking community. She was known for her skill in creating the elaborate wedding cakes and holiday pastries that were the specialty of the Moreau Bakery, and she trained several young women in the arts of baking and pastry making. Colombe also became involved in charitable work, particularly with the local orphanage, where she donated bread and pastries and helped to care for children who had been abandoned or orphaned. Her work with these children seemed to fill the void left by her own childlessness, and she was known throughout the neighborhood for her kindness and generosity. By the 1880s, Colombe had become a grandmother figure to Auguste's children and their offspring, and she was widely regarded as the matriarch of one of Toulouse's most successful baking families. She continued to work in the bakery well into her 60s, though she gradually reduced her responsibilities as younger family members took over the more demanding aspects of the business. In 1890, Auguste died of a heart attack, leaving Colombe a widow for the second time. At the age of 66, she found herself once again alone, though she was surrounded by the extended family that had grown up around the bakery. Auguste's eldest son, Jean-Pierre, took over the management of the business, while Colombe continued to live in the apartment above the shop and to help with the baking when her health permitted. The symptoms that would eventually lead to the discovery of Colombe's extraordinary secret began in the autumn of 1894, when she was 70 years old. She began to experience severe abdominal pain that was different from the mild discomfort she had occasionally felt over the years. The pain was sharp and persistent, and it was accompanied by nausea and loss of appetite that began to affect her overall health. Jean-Pierre insisted that his stepmother see a physician, and he arranged for her to be examined by Dr. Émile Bouchard, one of Toulouse's most respected doctors. Dr. Bouchard had trained in Paris and had recently returned to Toulouse to establish a practice that incorporated the latest medical advances and diagnostic techniques. Dr. Bouchard's examination of Colombe revealed an elderly woman in generally good health for her age, but with obvious signs of abdominal distress. He could feel a hard mass in her lower abdomen that seemed to be causing the pain and discomfort she was experiencing. The physician's initial diagnosis was that Colombe was suffering from an abdominal tumor, possibly malignant, that would require surgical removal. However, Given her advanced age and the risks associated with major surgery in the 1890s, Dr. Bouchard was reluctant to recommend an operation without more definitive information about the nature of the mass. Fortunately for Colombe, Dr. Bouchard had recently acquired one of the new X-ray machines that had been invented by Wilhelm Röntgen in Germany just a few months earlier. The technology was still experimental and not widely available, but Dr. Bouchard had been among the first physicians in France to recognize its potential for medical diagnosis. The X-ray examination was scheduled for January 15, 1895, at the Hôtel Dieu de Toulouse, the city's main hospital. Colombe was apprehensive about the procedure, which involved lying still while invisible rays passed through her body to create images on photographic plates. The technology seemed almost magical to someone of her generation, and she was not entirely convinced that it was safe. Dr. Bouchard explained the procedure carefully and assured Colombe that the X-rays were harmless, though in fact the long-term effects of radiation exposure were not yet understood. The examination itself took nearly an hour, as multiple images were taken from different angles to provide a complete view of Colombe's abdominal cavity. When the photographic plates were developed, Dr. Bouchard found himself staring at images that defied his understanding of human anatomy and pathology. Instead of the tumor he had expected to find, the X-rays clearly showed the skeletal structure of a fully formed fetus, complete with skull, ribcage, spine, and limbs, positioned in Colombe's abdominal cavity. The discovery was so unexpected that Dr. Bouchard initially questioned whether the X-ray plates had been mislabeled or contaminated. He repeated the examination with fresh plates and obtained identical results, confirming that Colombe was indeed carrying the calcified remains of a fetus that had apparently been in her body for decades. Dr. Bouchard consulted with his colleagues at the medical faculty of the University of Toulouse, and together they concluded that Colombe was harboring a lithopedion, a stone baby that had formed as a result of an ectopic pregnancy that had occurred many years earlier. The condition was extremely rare, with fewer than 300 cases documented in all of medical literature. The physicians were fascinated by the case from a scientific perspective, but they were also concerned about the implications for Colombe's health. The calcified fetus was clearly causing her current symptoms, and there was a risk that it could lead to more serious complications if left untreated. When Dr. Bouchard explained the findings to Colombe, her reaction was a mixture of shock, grief, and strange comfort. The revelation that she had been carrying her unborn child for 46 years explained many of the physical sensations she had experienced over the decades, and it provided a kind of closure to the tragedy she had experienced in 1849. Colombe's response to the discovery was deeply emotional and profoundly personal. She told Dr. Bouchard that she had always felt that something was missing from her life after the miscarriage, and that she had sometimes sensed a presence within her body that she could not explain. The knowledge that her child had been with her all along brought her a sense of peace that she had not experienced since Henri's death. Dr. Bouchard recommended surgical removal of the lithopedion, explaining that the calcified mass was likely causing her current symptoms and could lead to more serious complications as she aged. The surgery would be complex and risky, particularly for a woman of 71, but it offered the best chance of relieving her pain and preventing future problems. However, Colombe firmly refused the surgery. She told Dr. Bouchard that the child had been with her for so long that it felt like a part of her soul, and that she could not bear the thought of having it removed. She had carried her baby for 46 years, through 2 marriages, the raising of stepchildren, and all the joys and sorrows of a long life, and she was not willing to be separated from it now. The medical team was frustrated by Colombe's decision, as they believed that surgery offered the best chance of improving her quality of life and potentially extending her lifespan. However, They were forced to respect her wishes and to focus on managing her symptoms with pain medication and other palliative treatments. Colombe's case became the subject of intense medical interest, with physicians from across France traveling to Toulouse to examine the X-ray images and to study this rare example of lithopedion. The case was presented at medical conferences and published in prestigious medical journals, contributing to the growing understanding of ectopic pregnancy and its potential complications. The discovery also attracted attention from the popular press, and Colombe found herself the subject of newspaper articles and magazine features that sensationalized her story. She was uncomfortable with the publicity and preferred to maintain her privacy, though she did agree to be interviewed by a few medical journalists who treated her case with appropriate sensitivity. Despite her refusal to undergo surgery, Colombe's condition remained relatively stable for the next 2 years. She continued to live in the apartment above the bakery and to help with light tasks when her health permitted. The pain medication prescribed by Dr. Bouchard helped to manage her symptoms, and she was able to maintain a reasonable quality of life. Colombe spent her final years reflecting on the extraordinary circumstances of her life and the strange comfort she derived from knowing that her first child had never truly left her. She spoke often with Jean-Pierre and his family about her experiences, and she expressed gratitude for the long and fulfilling life she had been able to live, despite the tragedy of her early pregnancy loss. In her will, dictated to a notary in early 1897, Colombe made specific provisions for her burial. She requested that she be interred intact, without any attempt to remove the calcified fetus, so that she and her child could finally rest together. She also left detailed instructions for her funeral, asking that it be simple and dignified, with readings from the Bible that emphasize themes of maternal love and eternal reunion. Colombe Chatry died peacefully in her sleep on March 12, 1897, at the age of 73. Her death was attributed to heart failure, though Dr. Bouchard believed that the stress of carrying the lithopedion for so many years had contributed to her overall decline. She was buried in the Cimetière de Terre Cabade in Toulouse, in accordance with her wishes, with the calcified remains of her child still within her body. The funeral was attended by hundreds of people from Toulouse's baking community, as well as members of the medical profession who had been involved in her case. The service was conducted by Father Marcel Dubois, a distant relative who had known Colombe since childhood and who spoke movingly about her life of service and sacrifice. The medical significance of Colombe's case extended far beyond its rarity and scientific interest. Her story highlighted the limitations of 19th-century medical knowledge and the importance of new diagnostic technologies like X-rays in revealing conditions that had previously been undetectable. The case also contributed to the growing understanding of ectopic pregnancy and its potential complications, helping physicians to recognize and treat this dangerous condition more effectively. The detailed documentation of Colombe's lithopedion provided valuable insights into the body's response to foreign tissue and the mechanisms by which calcification occurs. Modern medical science now recognizes lithopedion as an extremely rare but well-documented phenomenon that can occur when an ectopic pregnancy results in fetal death and the mother's body is unable to expel or absorb the fetal tissue. The condition is most commonly seen in developing countries where access to medical care is limited and ectopic pregnancies may go undiagnosed and untreated. Contemporary treatment of ectopic pregnancy involves early diagnosis through blood tests and ultrasound imaging, followed by surgical or medical intervention to remove the ectopic tissue before complications can develop. The availability of modern diagnostic and treatment methods has made lithopedion formation extremely rare in developed countries. Colombe's case also raises important questions about patient autonomy and the right to refuse medical treatment, even when that refusal may result in continued suffering or shortened lifespan. Her decision to keep the calcified fetus within her body reflected deeply personal beliefs about motherhood, loss, and the meaning of life that transcended purely medical considerations. The story of Colombe Chatry reminds us that behind every medical case is a human being with complex emotions, relationships, and beliefs that must be respected even when they conflict with medical recommendations. Her choice to live and die with her stone baby reflects a profound understanding of her own needs and values that deserves our respect and admiration. The grandmother who carried a stone baby for 46 years teaches us that the boundaries between life and death, presence and absence, are more complex than we might imagine. Her story stands as a testament to the power of maternal love and the human capacity to find meaning and comfort in even the most extraordinary circumstances. In the archives of medical history, Colombe's case remains a landmark study of lithopedion and its implications for our understanding of pregnancy, loss, and the body's remarkable ability to adapt to unusual circumstances. Her story serves as a reminder that some of medicine's most important lessons come not from textbooks or laboratories, but from the lived experiences of ordinary people who face extraordinary challenges with courage, dignity, and grace. The woman who became a living tomb for her own child challenges us to reconsider our assumptions about motherhood, loss, and the ways in which love can transcend the boundaries of life and death. Her legacy lives on in the medical knowledge gained from her case and in the profound questions her story continues to raise about the nature of human experience and the meaning of maternal devotion. Next time, we'll explore a case that challenged Victorian understanding of human consciousness, a patient whose condition would force physicians to reconsider everything they thought they knew about the relationship between mind and body, leading to discoveries that would revolutionize neurology forever. If you found Colombe's story as moving as I did, consider subscribing to witness more extraordinary cases from medicine's most mysterious chapters. Each week, we delve deeper into the archives where human experience meets medical impossibility, where love transcends death, and where the past reveals the profound questions that continue to shape our understanding of life itself. Until then, remember that within each of us lies the potential for extraordinary love, sometimes expressed in ways that defy understanding, but always profoundly human in its depth and complexity.